Hello everyone. So I'll be taking a class on abutment evaluation in fixed partial tensions. I'll be including about the diagnostic forecast, radiographic examination, factors influencing abutment selection, special programs, questionable abutments, factors affecting individual teeth prognosis, treatment modalities, carious teeth, occlusal plane correction, non-post teeth, periodontally involved teeth, eroded teeth, resected, tilted teeth and parallelism, telescopic system, experiencing of the teeth. So before moving to the introduction, so basically the missing teeth may be replaced by one of the three processes types. First one, removable partial dentures. Second is basically a fixed dentures. Okay. So in that, a tooth supported fixed partial dentures or an implant supported fixed partial dentures. There are several factors must be weighed when choosing the type of processes to be used in a given situation. So biomechanical, periodontal, aesthetic, and financial factors as well as the patient's wishes are some of the more important ones. Fixed partial dangers that we transmit the forces through the abutment to the periodontium. Failures are due to poor engineering, the use of improper materials, inadequate tooth preparations, and faulty fabrications. Successful selection of the abutment for the fixed partial dangers require a sensitive diagnostic ability through knowledge of anatomy, ceramics, the chemistry, and the process of the dental materials, metallurgy, periodontics, phonetics, physiology, radiology, and the mechanics of the oral function is fundamental. Moving on to the definition of the fixed partial dangers. So the fixed partial dangers that are any dental processes that is rooted or screwed or mechanically attached or otherwise securely retained to the natural teeth, tooth roots, and or the dental implants or the abutments that furnish the primary support for the dental prosthesis and restoring teeth in a partially edentulous arch which cannot be removed by the patient. This is according to GPT-10. So basically, in simple way, the fixed partial dentures are the any dental processes that is later or screwed on the retained natural teeth which cannot be removed by the patient. Okay. So next one it is the abutment. So abutment, it is a tooth or the portion of the tooth or that portion of the dental implant that serves to support and or retain the processes. Context, that will be your edentulous space that is to be replaced. Okay. Every restoration must be able to withstand the constant occlusal forces to which it is subjected. This is of particular significance when designing and fabricating an FPD, because for the forces that would normally be absorbed by the missing tooth are transmitted through the conflict connectors and retainers to the abutment teeth. Abutment teeth are therefore called upon to withstand the forces normally directed to the missing teeth. In addition, those usually applied to the abutments. First one is your diagnostic cast. A life-size, lifeless reproduction of the parts of the oral cavity or the facial structures for the purpose of the study and treatment planning. Articulated diagnostic casts are essential in planning fixed prosthodontic treatments. The form and the contour of the prospective abutment teeth and gingival tissues can be visualized as well as the alignment and the contacts of opposite teeth. These procedures that will provide a simple evaluation of the occlusal relationship of the dental arches and the abutment teeth. So basically, the diagnostic cast, it is very important that will help us to evaluate the occlusal relationship of the dental arches and the abutment teeth. And in cases where if it is tilted, abutments are there, so like how we have to do the reduction pattern, all those things that will help. Next is your vitality testing. So the prior to any respiratory treatment, pulpal health must be assessed, usually by measuring the response to the percussion and thermal and electrical stimulation. So the careful examination of the Vitality testing is very essential. Misdiagnosis that can occur if there is not supply damage, but blood supply is intact. Next is your radiographic examination. So the primary purpose of the radiograph is to disclose hidden areas and the structures such as the deep morphology, pulpal outline, the periodontal ligament space, the alveolar bone, infrabony defect, residual factor, or the supernumerary teeth and the extent of the present or the past caries. So the periapical and the piping fillings are the most important in selection of abutment teeth. On occasion, additional views such as your TMJ radiographs for the patient with the TMJ dysfunction and the panoramic radiograph can also be useful. So these radiographs that will provide information that cannot be determined clinically and however are not a primary source of diagnostic information. So the intraoral radiograph, that examination that will reveal remaining bone support, root number and morphology, quality of supporting trabecular pattern reactions of the functional changes, both of the periodontal ligament space, areas of vertical and horizontal osseous resorption and the vocational involvement, axial inclination of the tooth, continuity and integrity of lamina dura, pulpal morphology, presence of pulpal diseases and retained tooth fragments. Next is the age of the patient. That is the most important thing in case of fixed process. That is, usually fixed processes are usually contraindicated in adolescents when the teeth are not fully erupted or when the pulps are excessively large and prohibit the retentive preparations. So in case if a bridge is not to be made, then a space maintainer should be inserted to hold the abutment and the opposing teeth in position. However, the tooth reduction should be kept minimal and the processor should be considered temporarily to remade when the pulp size permits. Next, moving on to the factors influencing the abutment selections. The choice and number of the abutments are determined by combination of load-bearing ability of the abutment teeth plus the forces and the stresses towards this will be subjected. The number of the root, their shape, length, alignment, and the bone height has a direct relation to the load-bearing capacity of the teeth. Okay, so the number of the root, shape, length, alignment, and the bone height that have the direct relation to the bone-bearing capacity, load-bearing capacity of teeth. The shorter, the more tapered the root and the lower bone level, and less unsatisfactory the tooth will be as an abutment. Next is your crown length. Okay, so the crown length, that is the abutment teeth must have an adequate occlusal cervical crown length to achieve a sufficient retention. Full coverage restoration and the crown lengthening are considered both the short clinical grounds to ensure adequate retentions. Next one is your crown form. So some of the teeth that have tapered crown form, which interferes with the preparation parameters, necessitating full coverage retainers to improve their retentive and aesthetic qualities. So the examples include the anterior teeth with poorly developed cingula, short proximal molars and surfaces, and mandibular premolars with poorly developed lingual cusp. So also some incisors that will possess a very thin, highly translucent incisor edges that making the use of partial coverage retainers aesthetically unacceptable. Root ratio, it is very important in case of fixed partial changes. Okay, so so the definition as follows: the it is defined as the physical relationship between the portion of the tooth within the alveolar bone compared with the portion not within the alveolar bone as determined by a radiograph. Okay, so it is defined as the physical relationship between the portion of the tooth within the alveolar bone compared with the portion not within the alveolar bone as determined by radiograph. This ratio is measured of the length of the tooth equivalent to the crest of the alveolar bone compared with the length of the tooth embedded into the bone. As the level of the alveolar bones moves apically, the laburnum of the position out of the bone increases and the chances of harmful lateral forces increases. So, for an optimum ground root ratio for an abutment, that is 2:3, and the ratio 1:1, that is the minimum ratio acceptable for the abutment under normal circumstances. So, the ground root ratio for an FPD abutment 1:2, it is an ideal ratio. So, the optimal ratio it is 2:3. Ideal should be 1:2, and the acceptable one is 1:1. So the ratio is based on the linear measurements only. However, when